First Lady. She's in the hospital right now. Was this an emergency? Update our viewers on what we know.
So, well, from what we know, this wasn't necessarily an emergency. However, the First Lady did enter Walter Reed Medical Center in Bethesda, Maryland. She had a procedure that is called an embolization procedure to treat a benign kidney condition, is what her office is saying. That operation was apparently successful. She is resting. However, a statement from the First Lady's office does say she will be in the hospital for the duration of the week. So clearly this was something that was concerning enough that she's making this lengthy hospital stay, but she is expected to be okay. Her office also said the treatment was successful and that she will be back working on behalf of children again soon. But again, a surprise announcement, a surprise situation here for the First Lady.
And we're told the president was at the White House while she was undergoing this procedure. But is he still at the White House? Has he gone over there yet? Is he waiting?
He is apparently on his way and close to being there. Her communications director, Stephanie Grisham, the First Lady's communications director, tells me that he is expected shortly. Clearly, this is a First Lady who's extremely private. She is not known to discuss her personal life in any way. She's extremely mysterious to a lot of people still. Clearly, the operation, whatever the procedure was today, she wanted to keep close to the vest.
I want you to stand by for a moment, Kate. I want to bring in our chief medical correspondent, Dr. Sanjay Gupta, along with Dr. Gregory Bernstein, a urologist, former military physician, and our CNN contributor, Kate Anderson Brower, as well. Sanjay, she's going to be in the hospital the rest of this week. It sounds pretty serious if you're going to be spending all that time in the hospital.
Yeah, I mean, I think that's worth pointing out. I mean, I don't know if this is because she's the First Lady, if this is because it's an abundance of caution. But if you typically hear of someone having an embolization procedure, which basically is just threading a catheter into one of the blood vessels and then using that catheter to go to an area to stop blood flow to in this case, part of the kidney, that can, maybe a night in the hospital, that's pretty typical. I don't know if they were more concerned about something with her in particular, but I think you're right. That's something that I think, there's still questions about why the longer hospital stay.
Well, let's ask Dr. Bernstein. You're a urologist. You're an expert in this area. What do you think?
Yes, well, I would agree with Sanjay in this procedure, although not, as Kate said, was not probably emergent. I think that staying over in the hospital for the course of the week, my guess is they're probably concerned that they want to watch out for any sort of complications. Sometimes after an embolization procedure, there can be some pain associated with the procedure, so they may want to monitor her for pain, make sure her pain is well controlled. And I'm sure they can do that a lot better at Walter Reed than they can do in the White House.
If one of your patients were going through this embolization treatment, would you normally expect your patient to be 3, 4, 5 days in the hospital?
I think it would depend on the situation. Not knowing or being involved with her care, I would certainly counsel my patient that that's certainly a possibility depending on how the procedure went, and give them the understanding that that's a possibility and certainly not out of the question.
And they keep saying this is a benign treatment. They could take the results right away and determine it wasn't cancer?
Great question. Again, not being part of the team, my suspicion is that this was possibly discovered earlier, and they may have done a biopsy ahead of time to confirm whether it was benign or malignant, which would have then directed the therapy that they did today with the embolization.
But they keep saying, fortunately, it was benign, which is good news. Sanjay, walk us through a little bit more of this procedure.
Well, in this case, and it is a procedure versus surgery, first of all, I think that those terms are important here. It involves a basically putting a catheter in one of the blood vessels and then threading that catheter up to the area that's in question here, an area inside looks like, or by one of her kidneys, and then basically injecting a substance, a glue-like substance or something, to stop blood flow to that particular area. If you stop blood flow to whatever it was that was being treated, and we don't really know the answer to what was actually being treated yet, but whatever it was that was being treated, if you stop the blood flow, it'll cause it to start to shrink. It'll prevent it from bleeding down the road, preventing a complication like that. So this is what an embolization procedure is. As Dr. Bernstein was mentioning, sometimes it can be associated with some pain. There's a concern sometimes of infection after it. I should point out that you're not actually looking at the mass. This isn't a surgery, so you're not actually removing the mass and looking at it. You're basically just trying to stop the blood flow to it.
What are Dr. Bernstein, what are the normal conditions that would lead a patient and a urologist, a doctor, to conclude this kind of procedure is necessary? In other words, what are the symptoms that would justify the First Lady saying, I got a problem?
So it's possible she may have had some pain ahead of time. Again, not knowing the nature of the lesion that they found, this benign condition. She may have had some symptoms. She may have had some pain, which may have prompted some additional testing to try to determine what the cause of the symptoms were, and they may have then discovered this lesion in her kidney, and then determined that was the cause, and then had made some recommendations on treatment options, with the embolization being probably the one that was recommended.
So let's say she was going through some pain.
Yes.
And so how do you determine whether or not this is a kidney-related procedure?
So she probably would have had some imaging done, possibly with an ultrasound or a CT scan, or possibly even an MRI, or a combination of all of those three to help make that determination.
And then all of a sudden they say, you know what, you got to go to the hospital and get this procedure.
Not necessarily. I think they would have looked at the imaging. They would have talked to her, talked about the diagnosis, talked about the pros and cons, some of the treatment options that are available, and then worked with her to make a shared decision about what the best course of action would be.
And would you regard this as an emergency procedure?
It's difficult to answer that question, Wolf, not knowing the nature of the condition. It sounds like if it's a benign condition, a benign lesion in her kidney, I would argue it's probably not an emergent condition, probably something that was planned.
And that she would go, because last week, as you remember, Kate, she had a big event at the White House, the Be Best event. She looked great. She sounded great. Was there any indication at all that there was a medical problem?
No. So the irony, sort of this news today, is that we've seen more of the First Lady in the past couple of weeks than perhaps we've seen in quite some time, quite a few months. She hosted the state dinner for France. We saw her in that white hat that day. We watched her host in the evening. We saw her again at Be Best in the Rose Garden giving a very long 11-minute speech, which for her is her longest public speaking engagement. And then even on Friday, we saw her at the West Wing at the Military Mothers and Spouses event, where she was with the president once again. She was delivering remarks. So certainly today's news with what we've seen of her lately don't exactly go hand in hand. However, as the doctor said, we don't know behind the scenes whether she was experiencing pain and sort of gritting through it, or whether she wanted to make sure her initiative came first and announce that beforehand, or what the circumstances were. But we've certainly seen her quite a bit in the past.
So as far as we know, she went over to the Walter Reed Army Medical Center earlier this morning for this procedure, right?
Sure. I think it's, we don't know that for certain. I think we can speculate that her doctor probably either said, arrive last night, get you prepped, or early this morning, get you prepped. What we do know is this afternoon, when the statement was released, her office was saying things did go well with the procedure, and that she intends to stay for several
The president did not go over there, right?
He did not go over there. And I think, covering the First Lady as I have and knowing her and how she operates, she's very private. I think it's somewhat remarkable that her office in the East Wing had zero leaks. I mean, here's the First Lady of the United States checking into a hospital for a procedure. No one knew a thing about it until after it happened, juxtaposed with what we're hearing this week about the West Wing and how that operation goes on. It's a very different scenario. I'm not surprised the president wasn't there. I would imagine that was the First Lady's doing. She likes to, with him comes more hubbub, more motorcade, more security, more press pool. Certainly knowing what we know about her, she's not one to sort of attract a lot of attention or want a lot of attention, and I would imagine this was her request.
We're getting the tweets are coming in. The speaker, Paul Ryan, quote, "So pleased her procedure was successful, wishing FLOTUS, the First Lady of the United States, a full and speedy recovery." The Senate Minority Leader Chuck Schumer just heard news that FLOTUS underwent surgery today. Sincere wishes for her speedy recovery. Has the president tweeted about this yet?
The president has not tweeted about his wife yet. He's tweeted about other topics since we've heard the news of his wife, but he has not yet tweeted.
I think momentarily, just the last moment or two, we're getting a tweet. We're going to put that up on the screen in a moment. Kate, you're the expert on First Ladies. What do you think of the way, first of all, this has been handled?
Well, as Kate said, I think it's surprising how private she has been, and then to get this sort of sudden news coming out that she had this procedure. This is not the First Lady to undergo a procedure in the White House. Nancy Reagan had a mastectomy in 1987. Laura Bush had a surgery for a pinched nerve. This seems slightly more serious than a surgery for a pinched nerve, certainly. But she has a young son. I'm sure that this was a nerve-wracking situation to be in. And of course, they're human like everyone else. They have surgeries and medical procedures that happen during their time in the White House.
He just tweeted, the President of the United States, heading over to Walter Reed Medical Center to see our great First Lady, Melania. Successful procedure. She is in good spirits. Thank you to all of the well-wishers. The President just tweeted that. What is the normal recovery time, Dr. Bernstein, as far as she's going to be several days in the hospital now, but what about after that?
So again, as Sanjay alluded to, this is a procedure, not a surgery. So I expect she's going to have a full recovery. I think once they get her through the initial perioperative or peri-procedure period, and her pain becomes more well controlled, she'll start to probably engage back in regular activities over the course of the next week or two would be my expectations. And that's how I would counsel my patients.
I want you to stand by for a moment. We're told the president's wheels up, Marine One, taking the president from the south lawn of the White House over to Bethesda, the U.S. Army the medical facility, the military medical facility in Bethesda, Maryland, in suburban Washington. Joe Johns is on the scene for us over there. Joe, update our viewers on what you're seeing, what you're hearing.
Wolf, it is the usual security when the President of the United States comes here to Walter Reed. The street here on Joan Bridge Road has been blocked off by police as they await the arrival of the president. Of course, he did solve the puzzle for us. There was some question about the president actually trying to travel through the sometimes legendary Washington, D.C. traffic, and now clear that the president has decided to fly over by helicopter. Of course, we do know that it's been a very closely guarded secret here until that statement came out this afternoon about the First Lady's medical procedure. And interesting also, Wolf, just to note, the truth of it is not just because of a VIP here receiving surgery. There are also strong rules at what has been called the flagship of military medicine about HIPAA, those privacy rules that guard electronic records of patients. So they are very much treating the First Lady like a lot of the other people here at Walter Reed get treated. A lot of secrecy and very carefully, of course, as the president makes his way here to Walter Reed.
Kate Anderson-Brower, you're an expert in this area. How much information, medical information, would they normally release about a First Lady undergoing a procedure like this?
Well, usually it is very private, but Betty Ford kind of paved the way when she came out with the release of her mastectomy, which she had in the 1970s, back when breast cancer was not something that people regularly discussed. Usually it is very private, but eventually they do have to release something. When Nancy Reagan came back from her surgery, she stood in her bathrobe and the resident staff all clapped for her. It's very emotional because everyone feels an affinity for the First Lady. And I think looking at her poll numbers that were released in the CNN poll last week, she's I think 57%. So she is well liked, especially compared to her husband's kind of divisive nature. And I think, as Kate said, she's been out there a lot recently, which makes this specifically kind of surprising.
Is it unusual that the president was not there at the Walter Reed Medical Center with her during this procedure, so he could be with her immediately afterwards?
Well, often the president is there, but George W. Bush was flying back from an overseas trip when Laura Bush was having an operation on a pinched nerve. I mean, I think it depends on the severity of the operation. I mean, how serious it is. Obviously, a pinched nerve is not as serious, seemingly, as this. But I think it's also indicative of the way their relationship is. They are not as sort of tight-knit as maybe the Reagans had been.
Well, talk a little bit, Kate, about that relationship.
Yeah, and I think to Kate's point, he didn't go to Jerusalem. We didn't see he sent, Ivanka and Jared were there and Secretary Mnuchin instead. That might be an indicator of that he wanted to be near home. I think, interestingly, we've seen, not only seen the First Lady a lot these past couple of weeks, we've seen her with the president the past few weeks. We've seen a few of those sort of awkward hugs and hand-holding moments, but certainly they've been together more. She spoke first at Be Best before he came up to give his remarks. She spoke first at the Military Mothers and Spouses event in the East Room. He got up there and said people love Melania Trump. We've watched them together engaging more in the past few weeks than we have this past few months with all the salacious headlines surrounding the president. I think there's maybe something there we can look at concerning that he must have known this is she's experiencing a medical condition, something they kept private, but maybe perhaps it helped him support her more or bonded more. We don't know, but certainly this relationship feels in the past week or so a bit more cordial, friendly, and cohesive than we've seen it.
Dr. Bernstein, every procedure has complications potential. We wish her, of course, a speedy recovery, only the best. But what the doctors have to say, there are potential some side effects or some procedures. But go ahead and explain. We're going to show some, while you're talking, the president boarding Marine One moments ago. He's already on his way to Bethesda Medical Center, but here he is leaving the south lawn of the White House. But what are the potential complications?
So as Sanjay alluded to, what they did is they threaded a little catheter into a blood vessel. So obviously the access to the blood vessel, there's a chance for bleeding at that site. There's a chance of pain at that site. And so that's probably the biggest complication. That's probably where she would have the most discomfort, is in the groin area, assuming they went in through the groin, which is the most common area. And then she may also have some pain or discomfort from the site of where the embolization, where they stop the blood supply to that particular part of the kidney. Other than that, there's chances of potential bleeding. Sometimes infection can develop afterwards as well. And those are probably the reasons they want to keep her in the hospital and monitor her.
Yeah, so that might be why, Sanjay, they want to keep her in the hospital for a few days just to be on the safe side. She is the First Lady, after all, of the United States.
Yeah, no, I think that's very fair. And, I mean, I think call it an abundance of caution, or call it because she is the First Lady. I think the only point that I think that should also be made is that when these types of procedures are done, there is sort of a normal course of hospitalization. And I think, as Dr. Bernstein mentioned, I think if you look at the data, most people, so this can even sometimes, these types of procedures even be done on what's called an outpatient basis, meaning you could come in and go home the same day. A lot of times patients are kept in the hospital overnight to be monitored for those very reasons. Make sure pain is well controlled, make sure the embolization did the job that they thought it was going to do, make sure there's no signs of any problems or infection. Just 3 or 4 days seems quite a bit longer than normal, but there could be a variety of reasons for that. Clearly in the statement they said everything went smoothly, so I don't think there's anything more, it sounds like, from their standpoint to worry about.
Yeah, but usually if you could get out of the hospital as quickly as possible, Sanjay, you know this, Dr. Bernstein, you know this, you don't want the patients to be in the hospital because there's potential for infection and there's a lot of germs in a hospital. You want that patient out of the hospital as quickly as possible, right?
Yeah, no, absolutely. I mean, as I'm sure Dr. Bernstein knows as well, hospital is where people often get sick because there's a lot of patients who have infectious diseases, things like that. So you don't want patients to stay in the hospital any longer than necessary. But again, I don't want to read too much into this. It sounds like from the statement things went smoothly. She is the First Lady. Maybe going back and forth. If she has to come back in for follow-up appointments, it could be too much. I don't know. I will say, as I think we all agree, that 3 or 4 days, 4 days till Friday, seems like a long time for this sort of procedure. But this is an unusual circumstance. Sounds like, given who the patient is in this case.
What about the credibility issue? Because you were there at the medical briefing when the president's health was discussed by his White House physician, Dr. Ronnie Jackson. The White House says everything is smooth, everything is great. She's going to spend a few days in the hospital, then she's going home. Should we just take that for granted?
It's a good question, Wolf. I think, I think there's sometimes, I'm not suggesting anything is inaccurate here, even with the press briefing with Dr. Jackson. I think it was more a question sometimes of not getting all the information, so more sins of omission, if you will. With the press briefing and Dr. Jackson, it became clear afterwards that President Trump had several tests to investigate the status of his heart. While we got all kinds of lab results about the president, most of them very normal, this pretty significant test, we weren't even told that he had that done. I happen to know that he had it done from other sources, and that's why I asked about it. Here, I'm not suggesting anything is inaccurate here. I think it would be nice to know what exactly the First Lady was having treated in this case. We're just told a benign kidney condition, which is good information to have. Benign, obviously, very important to know. What was it that was being treated? How was she having symptoms beforehand? What sort of prompted this? As Kate was saying, we don't think this was an emergency. This was probably planned, but those are things that we still don't know.
And very quickly, Dr. Bernstein, you worked at the Walter Reed Medical Center. Tell us about how good because she could have gone to any hospital here in Washington. There are excellent hospitals, George Washington University, Georgetown University, Sibley, plenty of good Washington Hospital Center. She could have gone to New York. She's probably familiar with the doctors in New York. Why Walter Reed?
Well, as alluded to, it is the flagship of military medicine. I think that they have, probably one of the reasons is they have the secure VIP ward up there where they can take care of the First Lady. You have to imagine she's not in a regular hospital room. She's in a very, I'm sure, nice suite. She's being well attended to. The security is excellent there. The medical staff is excellent. The nursing care is excellent. And so staying in the hospital a couple extra days is probably not what you would imagine staying in a regular hospital room is for her. And so for convenience, for privacy, for security reasons, I think it makes a lot of sense.
Sure, she has a single room. She doesn't have a double room, anything like that. We wish her, of course, only the best. We're standing by. The president's about to arrive at the Walter Reed Medical Center in Bethesda, Maryland. We'll have live coverage. Stick around, much more right after this.